What's Revatio and how is it used? Revatio is a prescription medicine used in adults to treat pulmonary arterial hypertension. With pulmonary arterial hypertension, the blood pressure in your lungs is too high. Your heart has to work hard to pump blood into your lungs. Indications. Revatio is indicated for the treatment of pulmonary arterial hypertension in adults to improve exercise ability and delay clinical worsening. The delay in clinical worsening was demonstrated when Revatio was added to background epoprostenol therapy. Dosage and administration. Revatio tablets and oral suspension. The recommended dose of Revatio is 5 mg or 20 mg 3 times a day. Administer Revatio doses 4 to 6 hours apart. In the clinical trial, no greater efficacy was achieved with the use of high doses. Treatment with doses higher than 20 mg 3 times a day is not recommended. Revatio injection. Revatio injection is for the continued treatment of patients with pulmonary arterial hypertension who are currently prescribed oral Revatio and who are temporarily unable to take oral medication. The recommended dose is 2.5 mg or 10 mg administered as an intravenous bolus injection 3 times a day. The dose of Revatio injection does not need to be adjusted for body weight. A 10 mg dose of Revatio injection is predicted to provide pharmacological effect of Sildenafil, and it's an dismethyl metabolite equivalent to that of a 20 mg oral dose. Contraindications. Revatio is contraindicated in patients with concomitant use of organic nitrates in any form, either regularly or intermittently, because of the greater risk of hypertension. Concomitant use of reutiguate, a granulate cyclase stimulator. PDE5 inhibitors, including Sildenafil, may potentiate the hypertensive effect of reutiguate. Known hypersensitivity to Sildenafil or any component on the tablet, injection, or oral suspension. Hypersensitivity, including anaphylactic reactions, anaphylactic shock, and anaphylactoid reaction, has been reported in association with the use of Sildenafil. What are the main differences between Revatio and Viagra? The main difference between Revatio and Viagra is in how they are used. Revatio is used for pulmonary arterial hypertension, while Viagra is used to treat erectile dysfunction. Revatio comes in different dosage forms such as tablets, injections, and oral liquids. Compared to Viagra, Revatio is administered 3 times per day at a lower dose. Viagra is taken at a higher dose not more than once per day. It is usually taken between 30 minutes and 4 hours before sexual activity. Side effects: mortality with pediatric use, hypertension, vision loss, hearing loss, priapism, vaso-occlusive crisis.